Okay, we're recording. Okay, let's go ahead and get rolling in. Today we're going to talk about performance monitoring, which kind of covers four subjects. We're going to talk about the macro level performance monitoring, which is the dashboard screen itself. Micro level, which are all the charts and graphs you see down at the objective and activity level. We're going to talk about some of the reports, not all of them, and we'll talk about that when we get there. And then we're going to talk about VMSG Public, how to create public-facing web pages out of any of the data elements in the system here. So let's go ahead and move forward here. So the first thing is to review, what is performance management. So you guys have been through operational planning in spades, and everybody should be, if you haven't already, be getting a certificate saying that you've completed the operational planning. Today, what we're going to talk about is the performance monitoring. So we're going to start out in the middle there with the macro level, which is again the dashboard screen. And then we're going to go to the micro level, which is the charts and graphs and things along that line at the objective and activity level. Then we're going to go into some of the reports. There's about four of the reports we'll talk about today, and we'll talk about why we're not going to talk about the other three at this point in time. And then at the end, we're actually going to go in and build a VMSG public web page around the plans that you guys all did in the training group. So it just gives us a kind of a visual demonstration of the status of all those plans. The reason performance monitoring, again, is critical is because of the PDCA cycle. So the performance monitoring is where we're collecting all of the information that is the where are we today. So we have a plan that has what are we trying to accomplish and where are we in getting to that plan today. The performance monitoring through the real-time planning, it tells us exactly where we are today, so we can compare the plan to the actual and make adjustments if necessary in here. And just another quick review on the operational planning pyramid here. So the organization, again, is your health department. We're going to talk a lot about groups today because groups is where the dashboard is, where the macro level performance monitoring comes in at the group level. And you guys have seen your group screen starting out the department at the top and then having some of the primary plans like you see here in the bubbles in there and such. Each group then has its own set of services or initiatives. Each service or initiative has its own set of high-level goals, which have its own set of SMART objectives, which have its own set of activities. So again, we're going to talk about the dashboard screen, which will be based on the selected group. And then after that, we're going to go down to the micro-level performance monitoring, which is down here at the objective and activity level. So let's go ahead and move into and we're going to use, by the way, pretty much the same example we've been using, the tobacco cessation example here, as you can see. So the dashboard screen, let's go live into the system here. Now, for purpose of the micro and macro level, I'm going to go ahead and use the USA Public Health organization here just because I know the data in there and I can explain it better that way. So we'll go to USA Public Health, and I will go down to, in this case, Community Health. So as you may recall, when you log into the screen, you're taken to a default group. So in this case, I'm the community health director for today, and I'm taken to my default group. The reason that that's kind of nice is when I log in, if I want to see the dashboard for community health, I don't have to go navigate anywhere. It's already taken me to my default group. Because all I have to do is click on the traffic light up here in the top right corner. What it's doing now is going into the background and literally gathering hundreds or thousands of data points together to be able to display a real-time status of community health on the dashboard screen itself here. And here it is. So first thing I like to talk about is this homepage button. There are three screens that you can set as your login homepage, meaning when you log in, it goes directly to that screen without having to go to a menu or any place else. If you're somebody who's using the system primarily for the dashboard here, you're a senior level manager, you're not putting in plans, you're not updating plans, but you want to know the status of your area of responsibility. So you can see up here, I'm looking at USA Public Health, Community Health Division as my area of responsibility. And if I were to hit this button here, a little dialogue will come up, so do you want to make this your login homepage? And then the next time you log in, instead of going to the main menu, it's going to take you directly to the dashboard for, in my case, it would be for community health, or if you're the health director, it could take you to the dashboard for the entire department on one screen. The other two screens that allow you to do that are the main menu screen here in the top right, the middle one, and then also the reports menu. The reason for the reports menu is in some cases, you're going to have somebody who's basic function is to generate reports, maybe for the health director or the community health director. So when they log in, they're going to go directly to the reports menu, make one click, and you've got the report that you need to do that. So it just kind of eases things of navigating around here. So let's go talk about again the dashboard or the traffic light up here in the top left corner. So I can look at the traffic light summary for the goals, the objectives, or the activities. You can see we've selected the activities now. And what I'm looking at is the number of traffic lights in each status. So the 1 green, the 3 yellow, 1 red, and the 5 gold traffic lights over here. I can also drill down on anything on the screen. So you'll notice I get the little click finger when I drill down or roll over anything down here. So if I want to go to that specific piece of information, I can drill down. So for instance, if I want to see these 3 activities that are yellow status, here they are. So instead of having to go, look around anywhere, navigate around, it's right there in front of you. So what I could do here is I could go in and, hey, maybe I forgot to update one of these, or maybe I need to go talk to Fred and say, hey, Fred, what's going on here? What do we got to do to get this back to a green or something along that line? Now from here, I'm going to go back to the dashboard, and you got 2 ways to do that. Number 1 is clicking on the back arrow here. Number 2 would be to go back and click on the traffic light again. Either one of them has to recalculate the dashboard screen, and it takes, again, about 10 or 12 seconds to do that. The reason for that is it's a multi-user system, meaning you could have a lot of people in the background doing updates in the system, and you want to have the latest information in there, so you're going to recalculate everything based on the current snapshot here. So this is my traffic light up here. Next to the traffic light is a schedule gauge. The schedule gauge is showing me that across these, looks like 10 activities, we are about 17 days behind schedule. The way that's calculated, it's at the activity level, because the activity is the only one that has the dates and the percent complete in there. So what it's doing is saying, let's say we have activity that is January 1 of 24 through December 31st of 24, and today is July 1st of 24. Means we're exactly halfway through the year. If that activity is marked as 40% complete, then we are 10 days behind schedule, and it's a 1-year cycle. So 10% behind schedule. So 10% of a 1-year cycle would be about 36, 37 days behind schedule. Now I could also have another one that is 60% complete halfway through the year. And if I look at that, it's going to be, again, 36, 37 days ahead of schedule. So the 2 of those will balance out. It would end up being on schedule. So that's how that number is calculated. Beginning date, ending date, percent complete. Now, down here at the bottom of the screen is where we kind of drill down into detail. So the first view we have is our activity leaders. So if I were by the way, if I'm on the objective screen up here, it's going to show objective leaders in here versus the activity leaders. But since I'm on the activity screen, we'll just go at activity leaders. So these are the people who are assigned in community health as activity leads. The first column over here, again, is when was this person last in the system and did their updates in here. Again, green is less than 30 days ago. There's no yellow on here, but if it was yellow, it'd be 30 to 60 days. And if it's red, it's over 60 days ago. So this is showing me that, we have 3 folks who are, right on track, less than 30 days, and a couple of folks who are over 60 days. I'd probably want to have a conversation with Tom and William to say, hey, do you need some training to be able to, to get up to speed so you're up with everybody else keeping this up to date here? If you recall, on the activity level, we can assign an FTE value, FTE full-time equivalent. And what we're doing here is rolling it up by person. The idea here is to make sure we're not overloading people. So if you're really using the FTE value to assign, how much of a person's time is dedicated to an activity, you don't want to be here at a 1.35 or a 1.73 FTE because you're overloading that person. Ideally, you want to keep everybody in the kind of the 1.0 FTE range. The lagging column here says I have one activity that is calculated to be behind schedule. It's the same calculation we talked about up here. The days column is the same as this schedule gauge up here, but just for the activities, in this case, that Diane is assigned to. So it's these, however, 20 activities, something along that line, that she's assigned to over here. Overdue says I have activities that the ending date of the activity is before today, and the activity is not yet 100% complete. And then the color code is the same I was talking about. So less than 30, 30 to 60, and over 60 days for the green, yellow, and red up here. And then we have the number of traffic lights in each status over here. So the number red, yellow, green, and gold. So that's my people. That's the first thing I want to look at is how's everybody performing and how updated is the information that I'm looking at. My next view here will be my groups. So right now we're selected on Community Health Division. You may recall that under Community Health, there was two groups, tobacco and WIC. So what I'm going to see is exactly this, Community Health as the top level group, and then you can see they're indented here a little bit. So tobacco and WIC are reporting directly to Community Health. The reason we include those groups is because the people who are managing tobacco and WIC most probably report to the community health director. So if I'm the community health director, I want to see my whole sphere of influence or my area of responsibility here. And then basically the same information over here that we just saw. And then my third view is priorities. Priorities, again, are the strategic priorities from your strategic plan mapped against everything else in the system. Now we're going to go over the way that mapping happens in the next training, which is probably a month out after you guys get a lot of information in the system. Here we'll go into what we call the three-dimensional planning training. But what it does is maps anything against anything in the system, kind of a cross-reference. But these would be the strategic priorities from the strategic plan for USA Public Health here. You can see there's 5 of them down here. And then basically the same information over here. But what we're doing again is determining how well are we performing in our strategic plan, which should be the overall plan for the department here. So that's the bottom, the drill down, if you will. Up here in the top right corner where it says My Priorities, these are objectives and they're individually selectable. Remember, the objectives are the target. This is what we're trying to accomplish. So by looking here, I see that we have one red objective and one green objective. Probably I don't need to watch a green one because the reds and yellows need a little bit of attention. The green ones mean that they're on track. So the way I get these on and off here is real simple. If I click on the green objective, I want to take it off there. It takes me right to that particular objective. This is the flag that sets them up there. So if I turn that off, it turns gray. And when I go back to the dashboard screen, it won't be there anymore. If I click it back on, it turns green and it'll appear. I can click on this flag on any objective in the system that you have access to. I can click on it and I can set it up on My Priorities. That's kind of nice to be able to just have those things that you're primarily focused on up there. Again, your priorities, and you'll see that the green one is now gone. So typically those are things that are reds and yellows and things that either you're working on personally or your team is working on, and you want to keep them front and center. So that's the dashboard screen. Now, again, the dashboard screen can be at any group level. So if I'm at the department level and I click the dashboard, it's going to show me a dashboard for the entire department. I can look at a dashboard just for my strategic plan, so I can narrow it down quite a bit there if you wanted to. I can look at a dashboard, in this case for finance or for admin or anything else that I have in there. So the dashboard, again, is based on which group you're looking at. Now, as we talked about in the overview, the dashboard's also available on your phone. So you may recall that this is not an app per se that you have to download. It is a dynamic app, we call it. So it's actually just like on your desktop. It's built in the web browser on your phone. So in the web browser, you go to the same link you do on your desktop, login.vmsgdashboard.com. Use exactly the same login credentials. It knows that it's on a phone and it brings up VMSG Mobile. So this is the same screen you just saw broken down into 3 phone screens just for real estate purposes. Top left corner, bottom, top right. And everything on here is pretty much identical. It's clickable, so I can take these My Priorities on and off just like I showed you there. I can drill down on any of these particular plan elements on any of these screens in here just to get to it. So same thing you had on your desktop, but on your phone for those folks who are not necessarily on their desktop all the time. So that is macro level performance monitoring. Now we're going to talk about micro level performance monitoring. And again, that is down at the objective and activity level. So this is kind of an example screen, but let's go back and take a look here. Okay, so I'm going to go back to, I'm at USA Public Health still. I'm going to go down to Community Health Division, and then I'm going to go down to our tobacco group. So this is the same plan that we've been working on, the tobacco cessation. I'm going to go ahead and drill on down from tobacco cessation to reduce smoking in high schools to our objective of reduce smoking at Wayne High School. Now on the objective and activity screen, you have this button here, which is just a simple timeline chart from the beginning of time, if you will, or the beginning of this particular program all the way through today. So here it is. So we're looking at the April 15, 2023 was the beginning of the program to reduce smoking at Wayne High School, and we were at a 0% reduction. And we slowly graduated up to here till we got to our target of a 25% reduction. So, it's a real simple chart, but it does give you all the information you need to know about this particular program over a period of time. Now, there's some tweaks that you can make to this while you're in this chart. The first one is you can say, I want to narrow the time range down. So you notice we're from August 15th of 23 up through, looks like June 30th of 24. Let's say I had this going for a couple of years and I just want to look and say, hey, how did we do in 2023? What I can do is just take this end date and make it, let's say, 12/1/23 and click off of it here, and it's going to narrow our chart down. So now we can just go through December 15th of 23. So what I've done is just said, okay, I want to look at just 2023, so I can narrow the time range down. When you do that, you've got a couple of choices down here. Raw says, show me every data point that was saved. And I'm going to go talk about where these data points come from in a minute here. Show me one per day, or one per week, or one per month, one per quarter, or one per year. Now, let's say that we are entering data every week, and I just want to see one data point per month. I've selected the month here. And because I have a chart that should be continuously increasing, obviously, to get to our 25%, I want to look at the last value in the month. So if I have 4 data values that I've collected each week, the last data value will be the end of the month, basically. My other choice here is the average. So now for a chart that's increasing, you're typically going to use the last value because you want to use the end of the month. But let's say we had that chart that was showing we did 9 training sessions per month. Remember that? So I have a little chart that's going up and down here. At that point in time, I might want to see the average for the month each time I do that. So it just gives the opportunity to look at the what timeline you want to look at here, and you want to see the last value or the average. So that's one of the tweaks. Right now we're looking at an objective, and you may recall that when we did the operational planning, down the bottom left corner, when you click on the little title down there, you can set the objective to be either a percent or a value. Values would be any kind of widget that you're counting in here. In this case, it's percent, and we know that it is, so that's what we set it for. So we're going to leave this as percent. The scale. You look at this right here. I'm going to go ahead and set this back to 2024. And it should bring out all of our chart again here. Okay, so the scale over here, when it's set to auto, says take the highest value in here and multiply by 1.1. So the highest value is 25. So we don't show the 0.5s over here, but it would be actually 27.5 in here. Now, what that does is give you kind of the maximum variation on your chart here. The other option I have is to make that 100%. So if I do that, it's exactly the same data, nothing different about it, but to me, it just doesn't look as good. So you want to be able to have as much as you can. That way you can see the variations easier. In this case, it's kind of almost flat down here. So auto is the default. And if you want to see it on a 100% chart, you can see it that way. So those are the tweaks that you can make to the micro level performance monitoring chart here. Now, the question always comes up is, where did that data come from here? So let's go back to our objective. Let's go over here. So there is a performance monitoring history record kept for every time you save an activity or any planning element. It's going to keep a history record. And the history records are behind this little hourglass here. So when I click on that, it's going to show me all of the history records for reducing smoking at Wayne High School. So they're in reverse chronological order. So you can see down here, 8/15 of 23, Fred Erickson added the objective. It was a green traffic light at that time. It was objective number 1, and our current status was 0%. Then you can see over time who added what when and what the status was, if there's any notes in there, and what the current status. This status over here is what we're actually mapping. So that's what's in the chart here. Now, every time I save the objective, so anytime I hit the save button, it's going to create a history record. Sometimes you'll create duplicate history records. Sometimes you do it on purpose, by the way. But let's say you're working with somebody and you're just showing them the system and you accidentally create a duplicate history record. What you can do is go into here, and it'll be at the top because it's reverse chronological order. So you can click on that history record, and then you can come down here. You notice the date appears down here. And then you hit the red X, and you can delete that history record in there. You can also recreate it again if you accidentally delete it in here. The other thing you might want to do is enter a history record that is, let's say back in 2022, maybe, or the beginning of 2023, something else. So you have history that you've kept before you implemented the VMSG dashboard. So what you'll do in that particular case is you will make all the settings down here that were at that point in time. So let's say it's 8/15 of 22. So I'm going to go in here and say we were maybe at a 10% reduction. I had different notes in here, whatever. So what I typically like to do when I do that is to make a screen capture of this particular screen and just set it aside. So when I'm done, I can go back and set everything back to here. So you're going to make the changes to wherever it was back then. You're going to hit the save button. Then you're going to go back to the history file. It'll be again be at the top. You'll click on the date, come down here and change the date to again like 8/15 of 22. And then it's going to move down to the bottom and it'll be your first data point. So the idea there is again, and really the only real use for that is if you're entering historical data from before you implemented the dashboard. Now, the one thing I do have to kind of warn you about is if you're going to be entering, let's say you have a year's worth of data on tobacco cessation before you rolled out the dashboard here, and you want to go enter that data. What some people have done in the past is they will go in here and hit the save button, and then they'll change the percent reduction, the notes or whatever, hit the save button, go change it to the next date, hit the save button, and just maybe create a dozen history records. And then they go over to the history file and they change the date on those records. Just kind of an FYI, that doesn't work well. The reason is because between the time that you save the record here and you go to the history file, there's a whole bunch of calculations that are done around that. Remember the time frame, whether you said raw, daily, weekly, monthly, annually, quarterly, whatever it is, all of that data is calculated. So if you're going to enter a history record, go from here to the history file, change the date, come back here, change the values, save it, go back and change the date. So you're going to go back and forth. And again, this happens very, very seldom. And if it does, you're going to do it one time because it's entering data that, from a past life, basically at that point in time. So that is the micro level performance monitoring. And again, that's available at the objective and activity level. And you've got the tweaks that you can do with the chart. Next thing we're going to talk about is reports. So there's a bunch of different reports in the system. And today, like I mentioned, we're going to talk about 4 of them here. So I'm going to go back to my groups here, select my tobacco group, and then here's my reports menu. The report that you'll use by far most often is the operational plan report. There's a couple others that we're going to talk about today. We're going to talk about the team lead report, which is kind of the second most used report, the partners report, and the partner activities report. Now you'll see the category tag report, the categorization report, and the categories report. Those we will not go into today. The reason is those are part of 3-dimensional planning. So there is a training. It's a pretty short, about a half-hour training that we'll get to. And that's the cross-categorization of everything in the system. And that's what those reports are all about, showing how we have things linked together in the system. So we will, after you guys are in the system for a while and getting all your stuff updated, we'll then go in and do the 3-dimensional planning training. So let's go ahead and start out with the operational plan report. So first thing to know, the report can be at one of 2 levels. It can be at the group level, so I'll have a report for the entire Tobacco 2024 group, or some plans start at the service initiative level. So in this case, if I have tobacco cessation selected and I generate the report, it will not contain secondhand smoke and tobacco initiation prevention. And kind of the way I know that is down here in what we call the cookie crumb. So you see we got USA Public Health, tobacco programs for 2024. And then over here, we have initiative number 1, and it says tobacco cessation. If there's anything in this little box right down here, the report will be specifically for that initiative. Now you'll notice when I go back to the group screen, it's still there. So it hasn't gone away. In order to get that to go away, I just need to click on the group again, and now it goes away. So if you're going to generate a report for like your strategic plan, for the entire strategic plan, you'll have to be at the group level. Some of the plans, like some of the training plans that we created, start at the service initiative level. So that's the reason for that. So let's go to Tobacco 2024 and let's go down to tobacco cessation, since that's the only one that really has any data in it here. Now to get to the report, I'm going to have selected that. I'm going to go up to my reports menu, the blue one up here. I'm going to click on operational plan report. I'm going to take it a couple seconds to get all that data together here. And then here it is. So this is the operational plan report. So the group was Tobacco 2024. Tobacco cessation is the initiative. And you'll see down at the bottom, there's no more initiatives. So because I was at the service initiative level, we have the goal. Everything that you see in blue is notes. So all of those notes at any level you put in there are going to be blue. The data sources that we created in there that we can say, okay, this is the place I'm going to go to get the information to update this objective is the CDC Smoking Cessation Fast Facts webpage. They all show up in red. So that's the basic report. So you can see the goal, objective, the activities, who's assigned to the activities, who's assigned to the objective over here, pretty much everything you want to know but we're afraid to ask. Now, you can tweak this report lots of different ways here. One of the things you might want to do at some point in time is say, okay, I have a plan that I put in the system, and it's kind of my plan for the year. And I have different things scheduled at the activity level for different periods of time. So let's say I want to look and say, what am I supposed to have completed in August? This button up here will give me a beginning and ending date, and I'll just put in August 1 through August 31st. And then what it's going to do is filter out everything that doesn't have an ending date at the activity level. I don't know why this thing's jumping around. Doesn't have an ending date in the activity level of within August. So what I'm looking at is what was I supposed to have completed in August in there. Now, the other thing I could do is say, what am I supposed to complete in September? So I could go put in September 1 through September 30th or whatever it is. And it's going to show me just those activities that are meant to be completed in September. So that's what the data is all about. As you recall, you can attach documents anywhere in the system. If I want to see the documents in the report, I just click on that. It's going to show me in green where the documents are attached. The documents always show up right underneath the plan element that they're attached to. So in this case, tobacco cessation plan is attached to the initiative tobacco cessation. Down here, we have a document that's attached to the goal. We get down here further, you can see we have 2 documents attached to the objective. And by the way, you can have as many documents attached as you want to. And then you see down at the bottom here, we got 1 attached down to the activity level. Anyhow, okay, so that's your documents. Now, where that comes in really handy is if you're using the accreditation or reaccreditation plan, you're going to have hundreds of documents attached. So you can generate the report and then show where all the documents are attached. So you can scan down through there and say, yep, I got documents attached everywhere I need to have them in there. I'm in good shape. The next thing we're going to be able to do is, let's say we want to be able to have just basically a clean plan to show somebody. I want to show them the plan without all the notes. And you know, over years, you could have pages and pages of notes in there. So I can hide everything that's in blue just by clicking the little hide button here. And so every note gets hidden basically in there. So in this case, I'm just showing them the basic plan without the notes or the history in there or anything. Go back to my rows here. Okay, the next thing I want you to look at over here in the top right are the levels. So what level do I want to show on the report? Right now, I'm all the way down at the bottom at the activity level. If I just wanted to show the objectives, I can do that. So now you're looking here, and I don't get down to the activity level. I just get down to the objective level. So I got objective 1.1.1 and 1.1.2 down here. I can also say I just want to see the goal level here. So now we see we just have the goals in there, no objectives or activities. And then the same thing, if I click services, it's abbreviation, if you will, for service initiatives, and it just shows the one. Now, if I had multiple services, obviously it would show that. Now back down to the activity level here. So I'm going to look at all the activities. Remember that with that pyramid, you could literally have hundreds of activities in something like your strategic plan. So if I wanted to be able to filter, I want to say, I just want to see where I really need help on the red activities. So I'm going to select the activities level over here, and then I'm going to select in my status drop down red. And what that's going to do is basically filter everything out that is not a red activity. So here we go. So the only activity that shows up is this one down here at 1.1.2.2 activity down here. So that allows me to filter. Now, the reason I went over here before I went to the status is because the status is dependent on the level you have selected. So if I wanted to filter out objectives, I could select objectives, then I'm going to have the traffic light for the objectives in here. So that's what the filtering the status does for you in here. Again, if you got 100 activities and I want to just see the reds, meaning I've got things I need to really dig into here, I can filter it that way. Now, how do you get the reports out of the system here? This bottom button down here at the very bottom is going to allow you to, first of all, save the report. Now, for those of you who understand web-based stuff, you see it's a report.htm or HTML. The report is actually an HTML web page. So if in fact you wanted to be able to create a web page, create a report, and make it a web page on your website or something along that line, it is in fact a web page in there. Now, because it's a web page, it's highly formatted. It's about the same kind of formatting as Microsoft Word. But what I have to do to start with is I have to save it somewhere. So I typically just save it on my desktop if I'm just going to print it off or something. So I'll go ahead and put it on my desktop here and save it. And then it's going to appear up here, VMSG report.htm. And so there's my report. Now, this is, again, that filtered report that I just showed you. From here, you're in the web browser, so you can do kind of anything up here. The three dots up here in Google Chrome give me the ability to print. I can print to a printer. I can print to a PDF file, whatever you want to be able to do. Now, I do recommend that you go to landscape mode and narrow margins to get the most on the page, and that's what this is all about here. So it just seems to work better, but you can actually, it'll format to print any way you want it. It just kind of, to me, it seems to go better here. Now, the other thing you can do with this report, again, it's a web page right now, so you can take and put this up on your public-facing website and say, here's the current status of our tobacco cessation program, whatever it happens to be. The other thing you can do is move this into a Word document. So to do that, again, because HTML is formatted very, very similar to Word, it makes it real easy. I just click on it anywhere. I'll hit Control-A to select all. I'll hit Control-C to copy it. I'll open up a Word document. And again, typically I'm going to flip it to landscape, narrow margins, and then I'll hit Control-V to paste it into the Word document. It should look exactly like this in the Word document. And the reason you might want to do that is you might want to go in and, highlight something in here, say, we're reducing smoking at Wayne High School, and put a yellow highlight on it. Whatever you can do in Word, you can do in here. So the idea here is that you can, it's a web page, you can print it off, you can print it to a PDF file, you can put it into a Word document, and probably think of 100 other things you can do with it as well. So that is how you get a report out of the system, and any report's going to have that same button at the bottom right down there. So that is again, you're going to use this report more than anything in the system. I'm going to go back, first of all, I'm going to go back to my Community Health Division group up here, go back to my reports menu. The next report I want to talk about is the team lead report. So if you want to know or see a report where Fred Erickson is attached to any activity or any objective, that's what this report's all about. And there's a lot of good uses for that. There is turnover in public health. So let's say we have Andrea in here, and Andrea is going to be retiring, pretty soon. So we want to be able to change everything that she's attached to somebody else. So I'm going to select Andrea here. I'm going to go down to the bottom. And I have my choices of individual, meaning the person I selected up here, group, which is, in this case, our group selected as Community Health Division. So these are the 3 people in Community Health. When I say all, that means everybody in the department. So that could be a very, very long report. It could take a while to generate. So if you do that, just be patient in there. But it's going to show you every activity and who's attached to the activity in here. Down here at the bottom right, I can say, do I want to look at activities or objectives? Let's say I want to look at just the objectives that Andrea, the individual, is attached to. Now, if I'm looking at objectives, there's only an objective lead. There's no objective team members. If I'm looking at activities, I can say, do I want to see just where Andrea is the team lead, or just where Andrea is a team member and not the team lead, or either, where she's either a team member or a team lead, or just meaning she's attached to the activity. But if I go back here to my objectives and I got 2 choices down here at the bottom. The magnifying glass says, give me an editable screen, just like we've been working on with the objectives and activities and such, or generate a report. So I'm going to go look at the editable screen here. So these are all of the objectives that Andrea is the lead for. So you see Andrea is attached to every one of these down here. Again, if Andrea is retiring and I want to go in and replace her with Fred or anybody else in here, I can just scroll down through here. I can go down here and change the reporting to somebody else, in this case, maybe to Diane or whatever it happens to be in there. So it allows me to very easily go through and do that. So this is the team lead objectives. I got the same exact thing for activities, other than you have, the activity screen down here with the activity leads that you're selecting. I'll go back to here. The other thing we have is the ability to generate a report. Here's where the report comes in handy. So again, this is community health. I'm the community health director. These are my people. And let's say I do monthly status updates with my people. I can generate the report out of the system for all of the objectives and activities that Andrea is connected to. And then I give her a copy. I get a copy. And we sit across the table and we just kind of review everything on paper. So I can sit down and say, is anything on here completed? Can we take it off? Or are the things on here you're working on that aren't yet in the system? Whatever it happens to be in there. So it really is a nice tool to be able to do that. So that is the team lead report. Again, you can kind of have a lot of different variations on there as you're doing it. The next report I want to talk about is the partners report. So as you recall, at the activity level, we can assign partners. And these are the 4 partners we just happen to have in the USA Public Health. So on the left side is my partner organizations. On the right side gives me some choices here. The first one is, do I want to print the selected partner only, in this case, VMSG dashboard? I'm going to say no. Do I want to print the contacts, so the people who are associated with VMSG dashboard? I'm going to say yes. And do I want the detail, meaning do I want email addresses, phone numbers, the titles, all that kind of stuff? I'm going to go ahead and say yes. And then when I click on this guy down here, it generates the report for me. So this is Andrea's car seat installation, the address, the people that are involved, all the detail and everything you need to know. Where this comes in handy, again, is if, over time, you're going to get a lot of partners involved in here. And you're going to want to go say, oops, Joe's car seat installation went out of business last year. We're not working with them anymore. So it gives you the ability to go back to the main menu and remove them as a partner in there. So that is my partners report. Now, the other thing is, where are specific partners attached to activities? Remember, we can attach at the bottom left corner, we can attach external partners to activities. So I click on this one. And I want to see, where is VMSG dashboard attached to activities? Or I can say, where is specifically Fred Erickson at VMSG dashboard attached to activities in here? So if I select the right side, let's say there's 5 of these contacts down here. I just want to see where Fred is attached. So maybe Fred is leaving a VMSG dashboard, something along that line, and we're going to change him out. If I want to see where anybody, if I had 5 of these, and I want to see where any of those folks is attached, I can select the left side. And again, I have basically the same information down here. I've got the search screen, which just shows me, in this case, it'll be the activities that VMSG dashboard is attached to. Sorry for this dead data up there. So down here, you can see these are the 2 activities that VMSG dashboard down here in the bottom left corner, you can see, and Fred Erickson is actually attached to those. So again, VMSG dashboard is moving on, or we're changing partners or whatever it is, just gives you the ability to very easily go in and do that. And then again, the same thing with the report. If I generate the report, it's going to give me a report that shows me exactly the same thing. It's going to look just like the operational plan report. We won't go into that detail today, but that gives me, again, I'm having a quarterly meeting with my partners. I want to go over everything that they're involved with. Same thing. I generate the report, give them a copy, give me a copy, talk it through, update the system, and away we go. So we've been through, okay. So that's reporting. So we've gone through macro level, micro level, and reporting. The last thing I want to go over today is the VMSG Public, which is the ability to create public-facing web pages around any data elements in the system. So I kind of went through and looked at some of the stuff, and what we're going to do today is take that training group that we've created, that you guys have all entered your plans in, and we're going to kind of build a web page around that. So let's go back over here. I'm going to go up to my group screen. I can start this at any level. I don't have to start at the group screen, but I'm going to go ahead and start up. Oops. I'm going to go back, I'm sorry, to your organization here. There you are. Okay, down to my group screen. So I'm going to go down to my training group. Now, under the training group, we have all these plans that you guys went ahead and put in there. So I'm going to start out at the group level for training. To create a VMS public page, you're going to create what we call indicator rows. To create an indicator row for the entire training group, which would be everything all the way down the pyramid in the training group, I click on this little button right here, and then I select what level do I want to summarize. I can say goals, objectives, or activities. So I'm summarizing the traffic lights. For now, I'm going to go ahead and say the activities level. I click on this. And what it's going to do is just build me a very simple indicator row that has a pie chart on it of the number of traffic lights and a schedule gauge in there. So here we are. So here's our pie chart. And you can see when I roll over, it says we have 35 green lights. We have 2 gold, 6 red, and 1 yellow light in here. And we're 9 days ahead of schedule. So this is our training sandbox indicator row. I'm going to go ahead and save that. So we've got it down there. Now, the check boxes that you see over here on the indicator rows are what is going to appear on the web page here. So I'm going to uncheck the ones that we've played with before here. So we've just got the training sandbox. Now I'm going to go down and create a couple of from these marathon or these service initiatives that you put in here. So I'm going to select the 5K marathon. Go ahead and generate the indicator row at the activity. I can change this up at any level, so I can go back and say I want to look at activities or objectives or goals. And again, stay at the activity level for now. Generate that. So here we go. In this case, it's all green. We've got 5 green lights, and we're exactly right on schedule. We'll save that. Go back up here again. We'll get Lincoln neutered. I remember that one. And we'll again summarize the activity level here. And again, we have, looks like 9 green activities and we're right on schedule again. Let's pick another one here. Set up a mobile flu clinic. So, I mean, that's all it is you're creating these indicator rows, and they can be at any level. So you can get all the way down to the activity level if you want to. For now, let's just go ahead and say these are the 4 indicator rows we want on the page. To create the actual web page out of that, you just hit this export button right here. And it's going to ask you, do you want to overwrite an existing web page or create a new one? The reason that's kind of nice is because you can go back and go through the same process and update it, let's say once a month, once a quarter, and overwrite an existing link. When you do that, maybe that's a link that you've given to your IT folks to put on your web page. So it's going to update the data in the background without having to change the link. So you don't have to put a new link on there. You can update the existing link. I'm going to go ahead and, for now, say create a new one here. So this is what it looks like. The VMSG training sandbox is our first row. And you can see, again, we have all the rollovers on there. And then we have underneath that, we have initiative 1, initiative 2, initiative 3, and we could have as many as we want down there. We could also get under the initiatives down to the goal levels, anything we want to have. So let's say, yeah, this is the web page that we want to create. So I'm going to go ahead and save it. And I'm just going to say training demo page, and we'll save that. Okay, now this is the link that has been created. You may notice that it's up on our secure servers, so it's always going to be available to you anywhere. So you don't have to worry about putting any code anywhere on your website. The link is right there. So you can grab this link. You can put it into an email. You can put it onto a web page. So let's go ahead and open up a web page with it. So I'm going to copy the link, Control C. I'm going to pop open a new browser window here, Control V, paste it in there and hit it. And there's our web page. So this is the web page that we just created. Literally, it's that easy, and it takes only a few minutes to do that. And again, you get to any level. Where I see this being used a lot is when you're doing like your strategic plan and you want to present to the board maybe. So you start out the top, your entire strategic plan on the top row, and then underneath that, you might want to go in and put in each of the strategic initiatives, and you can go deeper if you want to go into the specific areas. But this will give them a good snapshot of the performance of your strategic plan. If they see a lot of reds and yellows in there, they might have a lot of questions and things. So that is the VMSG public page. Now, over here on the left, you'll notice that I'm just down 2 levels. So I'm at the group and the initiative. I can also be at the goal, the objective, and the activity. So I can have a lot of text over here. And if I don't want to do that, I can edit that text. Now, the text is actually surrounded by HTML code. So again, it is a web page in there. And if you know anything about HTML, you can make anything you want over here. This is kind of a mini web page in itself, this little box over here. So if you're familiar with HTML, you can do whatever you want. But let's go look at kind of the basics that we use to create that. So HTML codes, and I'll show you these in a minute here. Font, the font faces Arial font. The size, I think, is 1:7. The color, you can put kind of anything in it. Put dark red, navy, purple, whatever you want to put in there. This would be the text that we're actually trying to modify. And then we use a slash font to close it. And again, if you want to learn about HTML, just Google HTML tags and it'll show you everything in the world. There's a lot of really, really good web pages out there on how to do this. And what's going to happen is the text is going to end up looking like this. So this text here turns into this on the font tag. Bolding is always kind of nice to have in there. So you put a bracket B, bracket slash B around the text, and it looks bold. Italics the same way, bracket I, bracket slash I. I can also combine these two tags. So I can put a bracket I in front of the bracket B, put a bracket slash I after the bracket slash B, and I'll have bold italic text. And then and these are just the ones that we used in the code to generate the look. You can put any HTML codes you want in there. BR is just a line break, so it's a carriage return. You'll put that typically at the end of the line, and you can put as many of them in a row as you want. So you can have bracket BR, bracket BR, bracket BR, and get 3 vertical spaces in there. So this is it. Now, you can actually go in and change the text in there, and I'll show you how to do that. Go back to the web page, go to the main menu, and then you scroll down to the bottom here where it says manage VMSG public performance indicator rows. So I'll click on that, and here's kind of that same screen we saw before. So I can go in here, and again, this is the HTML. If you're not familiar with it, you don't have to touch any of this. This is very seldom ever changed. But if you want to, let's say you don't want to have the training sandbox in there, is all you want to have is just the set up a mobile clinic. So I can go in here and highlight this and delete it, remove all the HTML tags here, and I'll save it. And then this is my preview button right here. So I'm just going to look at that same row. So basically, I took out everything except the actual thing that I wanted to show in there. So it really is very, very easy to do if you want to be able to do that. So that was pretty much what I wanted to go over today. Any questions? Anything else I can show you while we're here?
Hey, Fred, you said you recommended having another training some time from now?
Yeah, what it is the three-dimensional planning, which is how we kind of cross-link everything. So when we have the strategic plan, the strategic priorities at the bottom of the dashboard page, in order to get them to give you any information, we kind of have to link them to everything else in the system. And the three-dimensional planning does that, as well as linking anything that you can imagine you can link together. So you can say, for instance, you might have a grant or multiple grants, and you say, okay, this program is funded by this grant and this grant and this grant. So you can tag all that stuff. So typically what we'll do is after you've got, a lot of your stuff updated, maybe your strategic plan things updated in the system the way you want them, then we'll go do that training. It's about a half-hour training. It's real simple to do. And then we'll go through those other reports at the same time. So whenever you guys think you're ready to do that, we're happy to schedule that training as well.
And you said it's recommended like after we input in our strategic planning goals?
After you enter some information in the system, because the whole idea is to be able to cross-reference different plans in the system in there. And it's nice if you're looking at your stuff to be able to say, oh, here's our strategic priorities linked to our chip, for instance. So it does help to do that. Okay, well, if there's nothing else, again, my contact information is here. If you're going through and you see any anomalies or things that don't seem to be working right, please feel free to reach out to me. I'll be happy to pop open a GoToMeeting and work with you to get this stuff the way you need it. Okay, everybody, have a wonderful week. Thank you.
Thank you.